Thank you all for being here. My name is Dan Matthews. I'm the Digital Services Librarian at Moraine Valley Community College and the Awards Committee Chair for this year. So I'm happy to welcome you to the IACRL People's Choice Award in Scholarly Publishing webinar, where we get to hear from our winners and hear about their award-winning research, which is very awesome. So today we will begin the presentation with a video submission from Angela Jan and Eric Willie. Eric couldn't be with us today, but they recorded a presentation for us, and I will get that going in just a minute. And then we will go from there.
Good morning. Thank you all for being here today. My name is Angela Jung, and thank you for your recognition for being selected for an IACRL People's Choice Award for an article co-authored with Eric Willie using the cataloging code of ethics for retrospective project analysis. Our paper uses the cataloging code of ethics to evaluate an earlier project which examined how to ethically, efficiently, and accurately add demographic terms for African American authors to catalog.
Apologies for that. I'm seeing that you cannot hear the audio, so let me stop the share and see if I can get that fixed.
Good morning. Thank you all for being here today.
Is that better? Can somebody throw in the chat if that's working? Okay, great. Sorry about that. Here we go.
I am Angela Jan, and thank you for the recognition by being selected for an IACRL People's Choice Award for the article co-authored with Eric Willie using the cataloging code of ethics for retrospective project analysis. The work in our paper uses the cataloging code of ethics to evaluate an earlier project which examined how to ethically, efficiently, and accurately add demographic terms for African American authors to catalog records. By reviewing this project through the lens of these principles, we were able to examine how our practice was ethical in some ways, but could have been improved in others. This helped us identify areas of potential improvement in current and future research and practice, and explore ethical difficulties in cataloging resources with records that are used globally, especially in a linked data environment. We documented the studies in the article Applying Library of Congress Demographic Group Characteristics for Creators and today's focus publication. For context, I'd like to give a brief background on the Library of Congress Demographic Group terms and the cataloging code of ethics. The Library of Congress began exploring a controlled vocabulary describing demographic groups in 2013, and in 2015, 387 initial terms were approved as LC demographic group terms, LCDGT. This rose to 1,172 approved terms in 2018. As of this year, 2,126 terms exist. This vocabulary is designed to describe the characteristics of the creators of and contributors to resources and the intended audiences of those resources. Adding demographic group terms allows patrons to filter their search results based on these criteria. This is a record example of Trombone Shorty by Troy Andrews with LCDGTs describing the characteristics of the creator, including the ethnic cultural demographic group term African Americans. The Cataloging Code of Ethics was released in January 2021. It was the product of a multinational, multi-year effort by the Cataloging Ethics Steering Committee to create a useful framework for the discussion of cataloging ethics. Areas examined are authority work, classification, subject headings and controlled vocabularies, access scope and infrastructure, staffing working conditions, and resource discovery and access. The code includes 10 statements of ethical principles intended to aid the examination and formation of cataloging policy and practice to ensure that resources can be found and accessed by everyone. Here is a summary of the retrospective project. A Department of History graduate student located evidence of self-identification as African American for authors recorded on Wikipedia's list of African American writers. Catalogers then added the demographic term to bibliographic records. This work was the beginning of systematically enhancing catalog data with author characteristics to support making such information available in faceted results. Eric Woolley will now speak on our project analysis with the Cataloging Code of Ethics principles.
Hi, everybody. Thank you very much for the introduction, Angela, and thank you all for attending, and especially thank you for the honor of being selected for an IACRL People's Choice Award. We're very excited, of course. I apologize I can't be here to do this live and in person, and the theme here is going to be that we started out viewing the statements of ethical principles as a yes or no checklist. We thought we would look at our project and either satisfy a principle or not, without a lot of gray area, but we found it to be a much more valuable tool if you just viewed it as a way to think about your practice or your project and identify ways in which maybe you did well, but you still could have done a little better, or maybe ways in which you could look for some significant improvements down the line, or at least we could. So I'm going to go through the 10 principles real quick here and kind of give a little examples of both of those and most of them, I think. So the first principle, catalog resources with end users in mind. To facilitate, access and promote discovery. Before we started our project, when we were trying to figure out which demographic group we might work with, we consulted our reference and subject liaisons at Milner Library. The two groups that were suggested were child composers. We didn't have a full-time music cataloger at the time, so that seemed a little difficult. It might throw an extra level of difficulty in there. And the other group were African Americans, books written by African Americans. So we chose that second group as being a little less complicated for us, we hoped. And so we did have our end users in mind there, but we also haven't been able to do follow-up or user studies because, like some of you, we migrated to Alma in July of 2020. And of course, COVID. We're still kind of catching up a little from both of those. So that's an area where we could do more. The second principle, we commit to describing resources without discrimination, respecting the privacy and preference of associated agents. So we were careful to follow the Library of Congress guidelines when creating metadata describing creators. And the LCDGT guidelines state that self-identification as a member of a demographic group is the highest level of proof. And then you have reasonable evidence and then scholarly consensus. We gave those guidelines to our project subject expert, Tremaine Mitchell, and he focused his initial searches on published interviews with creators. So that sort of satisfies the respecting the privacy because they did give an interview that they knew would be printed and would go out to the public. Now, where this gets a little not as great is that, especially historical creators may not have envisioned their words being searchable on the internet or used for this purpose. They may have thought they were giving an interview to a local newspaper, not the World Wide Web. So that's an area, a little bit of concern for us. There's also, when it comes to preferences of associated agents, this is a controlled vocabulary, and synonyms or historically equivalent terms for African American were coded as African Americans. So we may not have respected the exact preference of one of these authors. Principle 3, we acknowledge that we bring our biases to the workplace, strive to overcome personal, institutional, and societal prejudices. Angela, myself, and Sandy Rowe, who is also involved in the project, we are professional catalogers. We've worked in materials that often raise ethical questions in description, archival, digitized materials, things like that. We felt strongly that for us to describe a creator as African American, even with a citation showing that the creator self-identified, would be ill-advised, if not flat out problematic. So we hired a history graduate student, Tremaine Mitchell, as I mentioned before, with experience in African American studies. So we mitigated our own biases there, I think, but we also want to acknowledge that we worked with Wikipedia, which has a white male bias. So we might have been able to find a better source if we had considered that factor. 4, we recognize that interoperability and consistent applications help our users find and access materials. However, all standards are biased. We might have been able to promote greater inclusivity by using a term from a more inclusive or nuanced vocabulary than what LCDGT offered. That would have been difficult for this project because we specifically wanted to look at the LCDGT, but if we were to turn this into a regular practice, we'd want to consider that. Does our controlled vocabulary do what we want it to? And even when interoperability and standards are applied consistently, discovery can be limited by the search tools used. When we started, the library used Voyager and EBSCO Discovery Service, EDS, and the Mark 386 creator-contributor characteristics fields were not displayed in faceted search results. So that would have been an obstacle for us. And we also want to note that cooperative cataloging is a huge boon for institutions and patrons, but it can also lead to inconsistent applications of standards. Principle 5, we support efforts to make standards and tools accessible to all catalogers. We used a controlled vocabulary developed by LOC and a Wikipedia list developed by community of users, and those are both freely available to anyone with an internet connection. That's a plus, but they're in English and therefore might be inaccessible to non-English speakers. So that's kind of set us back a little bit. That gray area I mentioned at the beginning where it's like, well, we did well in this, but this maybe better, room for improvement. We also used cataloging tools such as OCLC Connection and the RDA Standards Toolkit, and those come with fees, not only to use, but costs in training. So those may have not been accessible to all catalogers. Number 6 here, we take responsibility for our cataloging decisions and advocate for transparency. You can always do more here. You can never be too transparent, I don't think. But we held conversations with the Library of Congress subject specialists that developed the vocabulary. Paul Frank and Janice L. Young were both fantastic. We attended an Applying Library of Congress Faceted Vocabularies workshop, which included a focus on LCDGT held at the 2017 Online Audiovisual Catalogers, or OLAC conference, and Cataloging and Classification Quarterly published our peer-reviewed paper describing the process and findings, and we did include a pre-published version of that paper in our institutional repository, which is available to everyone. And we also shared our findings at 2 national conferences. So I think we did pretty well on transparency, but again, you can always do more if you keep at it, I guess. Principle 7, collaborate widely. We collaborated with multiple colleagues, consulted with history subject librarian Professor Vanette Schwartz when we were looking for a graduate student to hire. Professor Schwartz referred us to Dr. Tor Reed in the history department, and he gave us 3 potential candidates that he thought might do well. Jay Shorten and Adam Schiff both provided very valuable feedback and advice. Marilee Prophet of OCLC Research was very generous with her time and expertise, especially in discussing Wikipedia lists and categories. And it was out of scope for the initial project, but it would likely be valuable to conduct those user studies I mentioned before and consult with students and faculty using the sources we added metadata to and broaden that collaboration beyond the cataloging community to the public or our users. Number 8, insist on diversity, equity, and inclusion in the workplace. Grant funding allowed a budget of $12 an hour for a subject expert. $8.25 an hour was the minimum wage in Illinois at the time, so we were able to pay over minimum wage. We weren't able to offer health or retirement benefits, though. So again, like, yeah, we did well here, but there was still room for improvement. We were able to let Tremaine set his own schedule and provided him with a cubicle in the cataloging area of the library with a computer. And Milner Library and Illinois State University did provide financial funding for travel for the conferences and presentations I mentioned previously. Advocate for the value of cataloging work. The library's annual report featured an article about the project. The library's director of communications promoted the published article on social media through institutional Facebook and Twitter accounts, and I used my personal social media to promote the article. We also shared it with OCLC Research. Angela did a panel presentation at the ALA annual meeting, and so I think we did well there, but again, we may have been able to increase that impact by notifying students and faculty more widely of the project and its search results, people outside the cataloging community. And our last principle, principle 10, work with user communities to understand their needs. We did consult with our subject librarians and our subject reference librarians and didn't contact student groups or classes or professors and look at that aspect and get their input. So we haven't been able to do that yet. It's something on the horizon we'd like to do. It's just finding the time. We also wanted to note that we shared our records in OCLC. We added that creator field, but thinking about the code made us consider that there are other user communities as well who may not find it useful or might even potentially find it harmful. So as I said, we're right back to that gray area and kind of understanding if a project is ethical. And again, for us, looking at the code, not as a checklist of, yep, got it, or no, we didn't get it, was less useful than using it to reflect on the project and how we might be able to do better in the future or improve our practice from the day to day. And thank you all very much. I really appreciate it. And again, sorry I can't be here in person, but I believe Angela will be able to take questions now.
Awesome. Thank you. We will do a large group question and answer at the end of the session today. So let's move on to our second presentation. Okay, great. Take it away.
Thank you. Thank you both in terms of offering the IACRL People's Choice Award. And also, we just want to say that we're delighted that we are one of the awardees. As you know, we'll be presenting on the article that we had done of undergraduate students using, trying to understand more the relationship beyond GPA using a mixed method approach. And both Jung Scoulas and I were authors on the article. So just a little background about UIC. We're a public research university. We have over 33,000 students in 16 colleges. And I won't go over all the demographics here. You can see them, but you can see that we have a very diverse population, something that we're very proud of at UIC. And then we have several libraries. The daily library is probably the one most frequently used by undergraduate students, but we do have other programs that would utilize the Library of the Health Sciences in Chicago. There's a law library, and also we have regional locations that also include libraries in Peoria and Rockford. So one of the things that the library has been doing is ongoing assessment for both our faculty and students using biennial surveys for a number of years now. And you can see on the graph here that it's showing the timeline for when we have distributed our survey to the students. And the purpose of these surveys was to understand and identify our students' needs in order to use these findings for improvements in terms of working with the students and the services we offer, and also decision making, and to measure whether students' library experiences were associated with their academic success. So did their use of the library correlate with their GPA? And one of the key findings that we had in several of the surveys, including our 2018 survey, was there was a negative correlation between student library visits and their GPA, although at the same time, we found that students who use the library resources, such as journal articles and databases, those were positively associated with their GPA. And some of these findings were actually contrary to what other studies were finding, indicating that students' visits to the library were positively associated with students' academic success. However, we know that correlation does not guarantee causation, and it was really not clear to us what might be explaining this relationship. So as a result of that, we undertook this study to identify the primary reasons for students' library use, both in person and online, and to examine whether their academic related activities, such as studying in the library, using library resources, attending library workshops, had an impact on students' learning beyond their GPA through a mixed methods approach. And through this, we also tried to gain a better understanding of the idea of academic success and how that's really different by individual. Thank you. I'll now turn it over to Chung-Mi.
Good morning, everyone. My name is Jung-mi Scoulas. I'm the assessment coordinator of the University Library at UIC. And first of all, I really appreciate this award. And personally, I received this award 3 years in a row. So this means a lot to me. So I really appreciate the award committee as well as the community who read our research project as well as vote for us. So as Sandy indicated, we had the kind of limitations of the previous findings. So this is the goal of the research project, as you see on the left side, and also Sandy mentioned. So we used actually mixed methods approach, which is a start with the quantitative methods using survey, and then followed by the qualitative methods using conducting the interviews. But we are using these embedded mixed methods within one setting. So students were invited to complete the survey and then followed by having the interviews, because this allows us to see any like one data set supplement the other part of the data, so we can have a fully capture the need of this goal we want to accomplish. So we conducted 27 undergraduate students interviews between July 29 and February 2020. Originally, we planned to conduct about 50 students interviews. By the time we actually noticed the repetitive patterns of the findings, and at the same time, we had a COVID. So Cindy and I decided to conclude our conducting the interviews by February 2020. I'm going to share the two key findings from the quantitative data as well as the qualitative data. So one of the challenges we had was the GPA may not be a great indicator to understand the students' learning. So we adapted the learning outcomes from the project outcome model developed by the IACRL. And then this is just one component of the learning outcomes use of the library spaces. So given the time we are presenting, I'm showing just only the focus of the library space, but in the article, we also covered learning outcomes of the library website as well as the library instructions. As you noticed, the gray areas in yellow, so anyone students who actually most of them rated the library space environment to help me stay focused, as well as the library space contribute my ability to learn something new. So among these statements, one of the top one was that I'm likely to use this space again in the future. So project outcome model actually covers not only about the knowledge and also applications and other components. And we, as you see, those are the undergraduate students who answered in terms of the library spaces. And when we look at their GPA with their actual library use, actually it appeared that their actual frequency of the library use were not associated with their reported GPA. However, most of the students perceived that their use of the library positively influenced their GPA. This is the key findings from the qualitative data. So at the end of the interviews, we asked the students about how do you define the academic success with your own words. And many students actually mentioned that, yes, getting a good grade, such as a 4.0, is their definition of academic success. And other students mentioned that in addition to the high GPA, they are more focusing about the learning process. So learning something new or learning what they learned, they can actually apply into the real life experiences are the one of the primary themes that we discovered in terms of the academic success. So even we conducted this as more to better understand why there's a negative relationships between students' library use and their actual GPA, it was not still clear how actually their definitions of academic success, whether or not they met their own academic success. So this can be also another implications. What do you mean by, most of the institutions use the academic success as indicator of a GPA, graduation rate, or retention rate. But this kind of show in a way that our institutional indicator of academic success are aligned with our students' own definitions of academic success. What are the ways that we can support their own academic success? So, and also we also are aware of that individual perceptions of their own academic success is subjective and it varies by individuals. So for example, through the interviews, we discovered that students who study at the nursing considered that 3.0 is a higher GPA compared to students from English department. They consider the 4.0 is their highest GPA. So we also have that kind of a nuance of their own academic success in terms of the GPA as well as their own academic success. So to expand this research topic, right now, our research team, Cindy and I from the UIC and in collaboration with Northern Illinois University, we received a 2-year research grant from the IMLS, developing the assessment tools to understand exploring students' academic engagement. So in this case, we are not asking about only the library, but across the campus. How often do you use those academic campus services do you use? And also we also ask students about maybe use of the library spaces may not capture the entire understanding of the student's GPA. So we are asking students' perceptions about their abilities at the goals, maintain, regulate their behaviors, as well as their motivation to come to the library, and also asking their GPA as well. Of course, with their own definition of academic success. So we completed our data collection as a pilot phase during year 1 at UIC, and we are ready to conduct the surveys and online journaling for the spring 2024 at the both UIC and NIU. So most all of the tools, data we obtained, as well as the findings, will be publicly available for the fall 2024. So if you're interested about this research project and how you're going to use those tools into your library context, those tools will be available for the fall 2024. So I really appreciate if you have any ideas, or if you want to see how those tools can be applicable to your institutions. I think that'll be really interesting. You want to keep an eye on in the future. So this is about our research project. Thank you.
Thank you, Sandra and Chungmi. Appreciate it. And now we'll be shifting to Tina and Holly. And Holly, you should have sharing capabilities, and I'll just hang out to make sure that you do.
Great. Thank you so much.
Okay. All right, take it away.
All right. Are we seeing my slides? Okay. Great. Okay. Good morning, everyone. My name is Holly Beverley, and I'll be presenting today with Tina Griffin about our paper, Student and Supervisor Experiences, Conducting an Entirely Virtual LIS Practicum During COVID-19. Thank you to those of you who read and or voted for our paper for the 2023 IACRL People's Choice Award. We're extremely grateful for your support and hope that some of you will go on and read the published version of our paper in College and Research Libraries News. The learning objectives for this practicum were student-driven and based on my understanding of academic medical librarianship responsibilities. I wanted to gain practical experience before graduating from library school and searching for a professional position. Ultimately, we agreed to 5 learning objectives, which focused on virtual reference, constructing health science literature search strings, gaining experience with instruction, library research, and familiarity with collection management. Tina will share the practicum timeline and an overview of tasks next.
Hello, everyone. Sorry, I think my camera died. There we go. The practicum learning objectives were guided by what we could do at the time. We started the conversations ahead of COVID, which we didn't know what was coming. Our conversations with Holly happened well before COVID was even on anybody's radar, and kind of involved, you know, I had been a student at Dominican University. I had gone through a practicum as well. So we knew, I had known what was going to entail, and we knew that the objectives and her learning objectives were going to be engaged and driven by her. And so as we went through, you know, we were trying to align them with what our service profile was looking like. And it became clear as we were kind of going through the fall and listening to the news and figuring out what was happening in the media, that we were going to have to shift into a very, very unknown territory. It's not that practicums had not been done before in virtual spaces. There was not a lot of published literature that they hadn't been done, but there wasn't a whole lot of information as to how they were being done. There wasn't a lot of guidance as well. Technologically, we were not set up to do a lot of virtual instruction. We were doing some virtual consults. We had done some virtual instruction, but it was not really the mode that UIC had in a lot of places to do things like that. We had designed the practicum in such a way that the tasks in order to meet her objectives were very scaffolded. The papers do go into this more in-depth online, but we did structure things, and this is just kind of an info dump of the tasks and the timeline in the way that it took place. But a lot of January was a lot of onboarding to the types of tasks that she would be doing, a lot of reference to start with, a lot of observation, and observing instruction and consultations, becoming familiar with the things that were predominantly online that were routine for us, things like lib answers and chat and things like that, consultations that were moving online because of COVID. And some of that was just us, watching us and observing us moving into that online space for ourselves. It was a lot of watching us figuring it out as we were going as well. Figuring out how we were doing online instruction and figuring it out along with us as well. February in particular was moving her into the online space and having her do more of the particularly reference function on her own, with observation and guidance and supervision, and then starting the work of designing her own instruction, and getting prepared to do an instruction session, and also starting to participate in research, and working on a research project, which this was not actually the research project that she started to participate in. We're going to talk about that in a second, but we had a separate research project that I was involved in, that I was leading, and she wanted to have a research experience. And so I brought her onto that project and was working on some of the work with that. And that transition to stability with designing the materials so that she could actually work with reference and instruction more in March and April. And I believe that you did your actual instruction session in April, through the month of April, if I remember correctly. Yep. And so by the time we got to April, she had reached all of her objectives that she wanted to complete. We completed that research project shortly after that, writing up our literature review for that, getting all the reference and instruction objectives that she wanted completed, and things like that. So we were able to complete that within the timeline that she wanted.
Awesome. So I had spoken with UIC medical librarians a few months in advance, both for scheduling purposes and to clarify what would be possible to accomplish in a 120-hour student practicum. This was extremely beneficial for practical reasons and to get a sense of communication styles. So due to that time restriction of 120 hours of student work, I had to normalize 1 to 2 hours of work at a time, leaving projects incomplete at times when I would normally see something through. I learned that there will always be more work, and it's okay to leave some things temporarily unfinished. While getting to know my supervisor, project-based questions were helpful transitions into deeper knowledge or conversations about alternative career options and DEI-related topics. While onboarding, it took time for me to get used to engaging in verbal conversation with my supervisor while engaging with patrons virtually and tracking information across multiple browser tabs, though my capacity for managing information overload improved throughout the experience. In weekly meetings, receiving feedback on incomplete work and providing project updates felt intense, but was extremely worthwhile as it helped build my tolerance for constructive criticism. Still, that level of individualized time and attention is highly uncommon in most learning experiences. Tina will address her perspective on the practicum in the next slide.
I've had lots of opportunities to supervise students, mostly through my previous career in basic sciences and supervising students in research labs. Holly was my first practicum student within the library profession, and I was very fortunate in the fact that she was an excellent communicator and very motivated, very driven. And I think the structure of the Dominican practicum experience, which, you know, the student is in control and is the one who designs their learning objectives, actually helps that situation. But that being said, there's a few things that were interesting from a supervisor's perspective. One thing that, at least up front from me, is I do need to recognize that I did, again, having this experience during COVID, I had a designated workspace. At work, we were not required to come in. As liaisons, our library made the decision that the fewer people in the building was the safest decision. And as liaisons, we could do our work at home and keep as many people safe as possible by just having people not be around people. And at home, I did not have very many personal demands. My children are adults and do not live with me. I have adequate technology. I have stable internet. And so I did not have competing demands of small children or adult caregiving and things like that. And that did not place undue burdens on me that other people might have had. So I do want to acknowledge that straight off. That did actually help quite a bit with having a good practicum experience from a supervisor perspective. Structure also helped the having an online practicum a lot. Structure and establishing process. Weekly meetings do sound like a lot, but they also provided time and space and allowed us to see like big pictures and make decisions. 120 hours, 110 hours is not really that much time. And being able to kind of step back and allowing Holly to go and make decisions, going, you know what, these are the opportunities that you're going to have for a week. And where do you're not going to be able, this kind of goes along with the manage point, is at some point there was too many opportunities and she was going to get overloaded, or the work life was getting blurred, and we're like, you're going to max out your hours. You have to stop somewhere. You're going to have to make a choice. You cannot do it all, and that's okay. But we have to stop here and take a look, and you're going to have to pick something. We'll carry something over to the next week. But it's my job to point that out. It's my job to make space for that. It is my job to make sure that she meets her objectives, and I give space for that. But that's because structure has to be built in and process has to be there. And some of that process is the structure, but also it's making sure that communication standards are there and that documentation standards are there and that there's a project organization that's there, and it has to be consistent. And that there's contingency plans. COVID or not, expectations get derailed. It's just going to happen. And having things like a work log, because this was a virtual environment, the way we had set it up was that some of the work was going to be supervised, especially in the beginning, the supervised hours. We did things like, at first, we would be on simultaneously for chat, but we would be in kind of a Zoom environment where she would be observing me while I was there. And then eventually we would flip-flop where I would be observing her. And that way we could see how we're interacting, or we could correct if we needed to. And then we could have conversations about how do I answer this question? How do I not? What do I point to? What do I not? We can ask and get information, but then we can also talk about things in the background if we need to. But that also means there's unstructured, unsupervised time. And so the proportions of which and how that works, and where that shift happens and when that shift happens for supervised versus unsupervised work when you're in a virtual environment, is important to negotiate over time. And then within that also is the emotional component. Like when you're not in person, sometimes it's really hard to tell when somebody is getting overloaded, or it's really hard to tell. It can feel very impersonal. It can feel very, and I'm not saying that we have to just be super emotionally connected to all of our students, but we do have to be compassionate and empathetic to the students who are in our care, because they are in our care. They're our students. And that is important for us to be aware of their well-being and our capacity. And not only just because they're in our students, but we were also in a pandemic. So this is something that I did have to be aware of and that I was very cognizant of as we were going through this process. It's really hard to be not only a faculty in this position and having to go through this, but also be a student and having to navigate this and realizing that you're trying to have as best of experience as you can, and that you're about to launch into your career and it's very uncertain. And we don't know what's going on in this either. So there's more to the perspectives as well in the thing, but we're going to move on to, I think, key takeaways, which we have. There's several of them, but a few of them that we wanted to point out was that, you know, organizations need to contact our LIS programs and, you know, talk about their willingness to host students and maybe increase the awareness for library career paths. We didn't talk about this. We talk about it more in the papers, but, you know, this is more has to do with the health sciences, and Holly particularly wanted a practical experience for health sciences. And we are seeing challenges with practicums in health sciences in particular. And that's something that we talked about a little bit in there. We focused today on the virtual challenges and what it takes to do practicums in COVID in particular, and that connectivity and professionalism and attention. But it does open doors for things like specialized settings. Health sciences is a specialized field of librarianship. And so practicums that are virtual could be an opportunity for students to get into some of these specialized fields of librarianship. And that could be a way for more people to get some experience in fields that maybe were less accessible. And that could be things to know. I think it's important for students to have a realization that practicum work does have a component and a responsibility for them to take ownership of, and that is, you know, communicating effectively, using time wisely, doing some pre-work, and seeking out supervisors and sites that match, you know, what they want. Having some awareness of what their skill sets are and what their skill needs are, and seeing what the sites can do for them. And what, you know, Holly did a lot of work and did a lot of looking to see what she needed and talked with a lot of places, I'm assuming beyond us, to kind of figure out where she might get the experience that she needed. And that hopefully paid off.
Yeah.
And then when designing virtual experiences, recognizing that some in-person experiences and activities may not be replicable. It is up to the site institution to make sure that, you know, whenever possible, to acknowledge that when you're in a virtual environment, that that's not necessarily going to translate, and that we should make sure that that we can do that as much as possible. The example that we have is when Holly was designing the instruction experience that she created, that we made sure that even though it was a virtual instruction experience, it had to be because of COVID, that there were still things that she built or that she was aware that it would have to be adapted for in-person, or the ways that she could adapt it for in-person, so she could take that with her as her intellectual property to her instruction as she went forward, because she didn't have that in-person experience. She wasn't going to have that in-person experience.
So when talking about the process of publishing this paper, the idea for this paper was discussed during the practicum, but the majority of the work on the manuscripts took place as a new professional while I was working at UIC over the summer, and after I moved into a full-time professional position with Cadence Group at the Walter Reed Army Institute of Research and Naval Medical Research Center. So It was definitely worthwhile. It did pay off. I was able to obtain a summer job after the practicum with UIC, and then I moved a couple weeks thereafter into a full professional medical librarian position. So it was extremely beneficial to me. Tina and I had dug through literature on practicum studies, like she talked about earlier, and found that the student perspective was not present in the existing research on this topic. We queried multiple journal editors to gauge their interest in publishing our manuscript, and we got rejections from editors who were more interested in original research, but we knew our idea was unique, and so we worked to find a home for this piece. After writing a few iterations of this paper and going through multiple submission attempts, the paper was warmly received by college and research libraries news. The tone did change for the manuscripts. Early versions of the paper had more of a scholarly tone to them, and then we reformatted it as a commentary. But in the end, this piece was published using more informal voice, which allowed us to speak more personally about our experiences. And for those interested in reading the final published version, here are the citations for part 1 and part 2 of our paper, which we hope you find engaging and useful. Thank you very much for your time and attention. Do we have any questions? I guess I will stop sharing and then turn it back over to you.
Great. Thank you so much. So would like to move into a broad question and answer for all of our presenters today. Before we get right into that, I would just like to say thank you to all of our presenters for participating not only today in this webinar, but for submitting your works and also producing these works and contributing to like all of our knowledge and understanding. So appreciate that greatly. So are there questions? Feel free to unmute or throw questions into the chat. And we'll relay those to our presenters.
You're all so quiet today.
There is also the question and answer function that Zoom has, and I'm keeping an eye out for that as well. Yeah. So questions there. Tina and Holly, one of the things that I was thinking about as you were talking is the way that you adapted the practicum to be online and virtual. Has that contributed to how you're thinking about your current workplaces and changing like how a lot of the work that you're doing currently in your current positions and the positions that you are working with in your current jobs, thinking about how those can adapt or should be done in different ways that include this kind of like virtual component?
Yeah. So at least for me, the position that I'm in currently, I moved out to Maryland for a couple of years and was working in person at the base. And then over the last couple of months, I moved back to Chicago and transitioned to a fully remote position. Same job, same organization, but all of the instruction and the in-person orientations that I would do, welcoming new researchers who are Army or Navy doing research at the organization. Now that outreach is electronic. So a lot of the information that I learned from the practicum about developing handout materials and having things that are tangible and ready and available at the reference desk for folks that are in person has remained. So I make sure that I update a lot of the handouts and physical materials so that my counterparts who are on site have those available to them, and that my contact information on site is available so they know how to contact me remotely. In addition, a lot of the instruction that we do, whether it's on Teams or on Zoom, iterating the fact that, there is a communication pathway that exists after that session, after that instruction, and encouraging people to stay in touch is really important, especially working from a virtual model. So whether it's email or chat or phone call, it's like, here are the different ways that I'm available to you. And please do stay connected. And I'm also the person that does all the outreach at our organization. So some of our labs that are overseas, whether they're in Africa, Thailand, Germany, it's making that active effort to connect with folks that are far away, regardless of location or background, where they're from, what they're working on, to make it known that we are here to work with them. So a lot of the insight that I got about the liaison model at UIC was very valuable to me, because it translates very well into the position that I'm currently in. And I do credit a lot of the knowledge that I have now and I'm able to share to that experience. So I'm very grateful for it. Tina, is there anything that you would want to add?
I think the most that UIC is not considered itself, I work with the health sciences, particularly with medicine and pharmacy, and those colleges don't consider themselves online schools. And while they were online, they're trying to move themselves back into considering themselves in-person schools. And some of that is because they are seeing, and everybody's doing this, they're not seeing as robust reporting and grades and performance the longer they stay in online, and recorded lectures and things like that. The students want it. And they're trying to figure out, how do we optimize education? I don't want to say optimize, that's not quite the right word. They still want to see student success and they still want to, take care of their students, but professional education in the health sciences is extremely rigorous and it is very daunting, and they want to be as accommodating as they can. But at the same time, the medical exams are ruthless. And so it doesn't do the student service if they're not showing up to class, when showing up to class is the best path to getting them there. And so what we are seeing is things like, it is difficult for a student who wants help to actually physically come to the library. Now, foot traffic in the health sciences for sure has absolutely gone up. We see a lot of foot traffic in the library. They want to come back and be in the building. This is our highest year of foot traffic again, even though the building has been back open again for several years now, a couple years now. So this is the highest year in there. What I am seeing is that the number of consultations are up and they're almost all virtual. Almost. So what I'm seeing with that is the virtual component is staying in that interpersonal dimension where they want that one-on-one help. And I'm seeing the consistency there. And that looks very much like this one-on-one that Holly and I had. That relationship kind of building very interpersonal feeling, like that wants to be maintained. And people want that individual level of attention. But then they want the physical space to do the rest of their stuff, or they want to be in the classroom, and the classroom learning is still happening and they need to physically be in the classroom to get that done. But then when they want the rest of their work, they want that individual attention. And that's where I'm seeing that translation into like staying in the virtual space.
Yeah.
Thank you. I'm looking for other questions in the chat. I'm seeing a number of thank yous to our presenters today. Really appreciate your time and effort in doing this work. Okay, I think that is it for questions for everybody. And we're at time, so I just wanted to say thank you all so much for giving your time and your effort and your work in putting this webinar together and being a part of it. And wanted to plug the next year's submissions are open.
Oh.
So we have published this year. We are looking for submissions for the 2024 award. So I know you all are doing good work. I know people in our attendees are also doing some good work in doing that publishing. So keep an eye out for that call for submissions, and we look forward to the award next year. So thank you all so much, and enjoy your weekend.
You too.
Thank you.
Thanks.
Thank you.